Alrighty, so today we're going to be talking about adverse childhood experiences, or ACEs, and how the impacts of childhood trauma can carry into adulthood. My name is Elizabeth, and I would like to recognize that a significant amount of my content comes from the CDC. So first of all, what are ACEs? ACEs stands for Adverse Childhood Experiences and encompasses traumatic events that occurred between ages 0 to 17 that could potentially result in trauma. So the framework and concept of ACEs comes from a study that was completed by the CDC and Kaiser Permanente in the late 90s. Study participants went through a physical exam and then talked about their past trauma and reported on their current health status and behavior. An example of a question would be, have you ever had a problem with alcohol? And then asking about if they had lived with someone that also had a problem with alcohol before. ACEs falls into the following three buckets: abuse, household challenges, and neglect. And you get a score when you take the ACEs quiz, and each point on the quiz is one ACE and is one potentially traumatic event. So if you had experienced emotional abuse, physical abuse, and sexual abuse before age 18, you have an ACEs score of 3. Other ACEs include household challenges like violence to the mother, household substance abuse, mental illness, parental separation and divorce, incarcerated household member, emotional neglect, and physical neglect. So how common are ACEs? In the original ACEs study, we found that all populations were at risk for ACEs. Only 36% of persons had experienced no ACEs whatsoever. And then 12.5% of the people that took the study had 4 or more ACEs, with different percentages in between. The following ACEs down below are the ones that came up to be the most common ACEs. Separation and divorce, mental illness, substance abuse, physical abuse, and emotional neglect were very common. ACEs data is still being collected by the Behavioral Risk Factor Surveillance System through the CDC, also known as the BRFIS. And these are the following states that are collecting the data throughout the following years. So the current prevalence of ACEs from the BRFIS study from the years 2011 through 2014 include these ACEs as being the most common. Emotional abuse became significantly more common. Substance abuse is still common. And now 38% of people have experienced 0 ACEs as opposed to 36, but 16% of people had 4 or more ACEs. We'll talk about the significance of having more ACEs versus less ACEs further on in the presentation. So in Idaho specifically, our prevalence of ACEs is really comparable to the US overall and has been following in the past few years. Data from 2019 reports that 21% of Idaho children have experienced 2 or more ACEs. In the nation as a whole, 20.5% of children had experienced 2 or more ACEs. So we're doing slightly worse than the national average, but not by much. We are 24th out of 50 states. We're on the front end of being more positive, as the 50th state has the highest prevalence of ACEs, and that's Oklahoma. The state that has the children with the least amount of ACEs is actually California. As we can see in our state, we struggle with economic hardship significantly. We also struggle with parent or guardian time in jail, and significantly more mental illness than the rest of the state as a whole. We know our state is really rural and we don't have a lot of access to mental health providers, and that could be one of the reasons why that percentage is so high. And then we also struggle with substance misuse. As you can see in the following graph, our prevalence of ACEs has been falling over the last few years. So now transitioning into talking about the long-term impact of ACEs on someone's health and well-being. Unfortunately, the trauma itself, just being abused, isn't the only impact on a person and on a child, but the ACEs themselves are linked to adverse health outcomes such as mental illness, substance misuse, chronic health problems, and disease. So, as I touched on previously and said that I would get back to, according to Nadine Burke-Harris, author of The Deepest Well, there's a dose-response relationship between ACEs and poor health outcomes. And so this means that if you have more ACEs, then you're more likely to experience adverse health outcomes such as disease. And so the more ACEs you receive on your score, the higher chance you have of developing adverse health outcomes. So having lower ACEs is not as deadly, but it can still impact your health. Having an ACEs score of 2 or more makes you twice as likely to develop an autoimmune disease. So It's still deadly, but it's less deadly. And we can kind of think about this like smokers and lung cancer. So if I have a couple cigarettes, then I'm not as likely to develop lung cancer as someone that has been a lifetime smoker and has smoked a lot. If I have a lot of trauma as a child repeatedly through my life, very traumatic events, then I'm a lot more likely to experience adverse health outcomes than someone who had one traumatic event as a child. So the long-term events and consequences of ACEs include injury, mental health, maternal health, infectious disease, chronic disease, risky behaviors, and loss of opportunity. And some examples of this include cancer and diabetes, depression, suicide, PTSD is super common, fractures, burns, alcohol and drug abuse, unsafe sex, loss of income. These are the different things that can be the result of adverse childhood experiences. So kind of getting into why this could be. Why is it that ACEs can cause these adverse health outcomes? And that is due to toxic stress. So when we think about stress in our bodies and children developing and having stress in their bodies, think about the fight or flight response. And if this analogy is from Nadine Burke-Harris, if you're in the woods and you see a bear, your body will go into fight or flight. And the hormones in our body that are part of the stress response, such as cortisol, epinephrine, adrenaline, those classic players that we know about, those will start coursing through my body, and I'll have a physical response to that stress of seeing the bear. My heart rate will start to go up, my blood pressure is going to rise. I'm preparing to meet that challenge. But as she talked about, a lot of children live with the bear. And so they have an abuser in their home and they're constantly in fight or flight response. Their blood pressure is constantly being elevated. Their heart rate is constantly going up, and those hormones are coursing through their little tiny bodies frequently. And those hormones aren't bad for you. That stress isn't bad for you, but in a large amount, consistently early on in a child's life, that is bad for you. Having an elevated level of cortisol in your body could potentially lead you to having heart attacks and stroke later down the line. And so you can see how that stress alters your brain and alters your body. We see this with people who go to war and they have PTSD. All that stress that they experienced, all that fight or flight, all of that impacted their brains, impacted their social and emotional health. And this is true for children. These hormones aren't bad, but they're bad in large amounts, and they're bad really early on in life. And a lot of children experience toxic stress in high doses when they're being abused. So as we can see, as we talked about previously, the toxic stress that comes from ACEs can then lead to brain development being altered, and then potentially from there, social and emotional and cognitive impairment, which could then lead to an adoption of a health risk behavior. So if I don't have healthy social and emotional boundaries and health in and of itself, then I might choose to have unprotected sex, or choose to become an IV drug user, fall in with that because I just need coping mechanisms from all of the trauma that I experienced as a child, which those things could then lead me having unprotected sex, and being an IV drug user could lead me to contract HIV, and then I could die early from a compromised immune system. So it's not a direct path. It's not a straight line between ACEs and early death and disease and adverse health outcomes, but you can see how that toxic stress in our brains being changed as children who are abused could then lead to further down the line early death. So you also might be thinking at this point in the presentation, wouldn't it just be that these kids, they don't have access to healthcare, and so they don't have access to mental health providers, so of course their social and emotional health is impaired, they're uninsured, they live in bad neighborhoods, they see a lot of violence. If they just had more money and more education and weren't in poverty and weren't at risk and experiencing racism, then they would be healthy. It's not that these ACEs are causing their poor health. It's systemic racism and the fact that they don't have access to education. So no, we have found, looking back at the Kaiser study, that 70% of those people who were in the original study were Caucasian, and they were college educated, and they lived lived in San Diego. So they had plenty of access to healthcare. Kaiser Permanente was their healthcare provider. They had education. They were not in poverty. They had all the access that they could possibly get. So it wasn't that those things were causing adverse health outcomes. The research that we have seen since that original study makes it clear that ACEs in and of themselves are a risk factor for many of the most common and serious diseases in the US, regardless of income or race or access to care. Again, Nadine Burke-Harris. So the ACEs themselves are causing these outcomes. It's not the social determinants of health, such as poverty and race, income level, etc., that's causing disease. It's the ACEs. ACEs are preventable, mainly through investing in positive parenting skills and in communities through programs such as maternal and infant early childhood home visitation, where nurses go into homes and educate parents on how to be a positive influence on their children. Programs like that, investing in communities through enhanced primary care, family-friendly work policies, legislative approaches to reduce corporal punishment, all these different things, investing in families and communities and providing safe, positive spaces for these children can work to prevent ACEs. But if we cannot prevent ACEs from happening, there's a concept called resilience, which can lead kids to thrive despite having ACEs. So ACEs do have negative effects, but it's not a guarantee. As we talked about, it's not a straight line between having ACEs and having adverse health outcomes. Resilience can actually mitigate the negative effects of having ACEs. Resilience is a positive adaptation within the context of significant adversity. Thank you, Minnesota Department of Health. And that's through protective factors. And a lot of this comes from a child's own biological and developmental characteristics. So the child's own personality and ability to adapt. And then also, as we talked about with prevention, a lot of it is family and community systems working to prevent ACEs to begin with. So even if you had a very traumatizing childhood and you had a lot of trauma, you had abuse, you had neglect, household challenges, all of the above, if you had resilience and you had protected factors, then those ACEs are less likely to impact you. So maybe you were abused as a child, but you had very good relationships with your parents who really invested in you. You were healthy as a child yourself. You were emotionally healthy. You had agency and belief in a higher power. You had teachers that supported you. People really came around you. Then you're more resilient to those ACEs, and they might not affect you later on. And here is a list of those protective factors from the Minnesota Department of Health. A lot of that, as we talked about previously, really is about caregiver knowledge and whether or not your parents themselves have resilience and you have a positive, close relationship with those people. You yourself as a child have a sense of purpose. You have problem-solving skills, self-regulation, and agency. You are socially, emotionally healthy as a child. You have social connections and friends and relationships with parents, teachers, other children. Your family has socioeconomic advantages that provides you with concrete support. And then again, those communities, those social systems and programs are coming around you to support you as a child. So we're going to transition into talking about how our knowledge of ACEs can make us into better people. So what can we do with this knowledge? We know about ACEs. What are we going to do with it? So it's important to recognize, firstly, that only 38% of people don't have ACEs. So most people do have ACEs. Most people have experienced significant adversity. So just our knowledge that this exists and that a lot of people have been through this challenge is super important. And through that, we can recognize that we need to be able to give grace to ourselves and grace to others. I think it's easy for us to think this person is making a risky choice. They're engaging in risky behavior. I don't understand why they're taking these risks with sex and alcohol, or maybe our own stigmatization around mental health problems, unintended pregnancy, STIs. It's important to recognize that ACEs is part of that story. You don't know why someone is choosing to make those decisions, and just because they're not the same choices as you doesn't mean they are choosing to be risky necessarily on purpose. You need to understand that there's a lot more to that person's story than you would initially realize, and to stop stigmatizing lifestyle and behavior choices that you wouldn't agree with, as well as things like obesity, heart disease, STIs, etc. We can also work to prevent further exposure to trauma as people in the public health field, as healthcare workers, through educating people on how to prevent themselves from being further abused and further traumatized in their lives. And we can give students skills around safe drinking, around consent, around healthy relationships. College campuses often have, such as Boise State's Department of BroncoFit, alcohol education programs, which we implement to reduce high-risk drinking, which in turn may reduce exposure to traumatic events, such as physical assaults, accidents, motor vehicle accidents. I would also add in sexual abuse and trauma in that category, so we can help people prevent further exposure to trauma. Lastly, it's just super important to be kind and compassionate, to be an ally and a listener and a resource. You don't know someone's story again. There's a lot that could have happened that plays into who they are as a person now, and just ask the right questions and be open and willing to hear what someone has to say. I'm super interested in ACEs myself because I understand that if we can prevent this, if we can prevent children's exposure to trauma, then we can prevent a lot of the things that are causing disease in our society, such as obesity, COPD, autoimmune disease rates. We can help move the needle if we're working early on in these children's lives. As Nadine Burke says, we all need to be part of the solution. If we each take our own contributions and our own piece of the puzzle, we can put them together as a society and start to solve this problem, essentially. There's some Boise State resources for counseling, as well as filing a care report for someone that you're concerned about, and the National Suicide Prevention Hotline. If you're curious about your own individual ACE score, you can take the ACEs quiz brought to you by NPR, as well as the resilience quiz. If you're interested in learning more about ACEs, the CDC is a really great place to start. They have a very comprehensive website on all things ACEs, and then these are my sources. Thank you for listening, and I hope you learned something new about ACEs today.